At this meeting, I summarized what was presented in the management for patients with early stage breast cancer. So I went through the trials, some of the key presentations for different subtypes of breast cancer. For the hormone receptor positive disease, I focused on the discussion on the TAILOR-X trial when they looked at the impact of clinical factors, how they may impact the prognosis, and how menopausal status and age may play in the intermediate risk category patients. And then we discussed extended adjuvant therapy, the GYM4 trial, and also the Trans-ADAM study when they looked at breast cancer index, whether that can help to identify patients who may really benefit from extended adjuvant therapy. I think the data looks really promising. Patient who had node-positive disease, who had a BCI, like breast cancer index, HI low group, did not really benefit much from extending the therapy. But if they had HI high, then they had a really absolute difference of 10% if you extend their treatments. And for the triple-negative breast cancer, I talked about the abstract that mostly discussing whether the HRD, which is homologous recombination deficiency score, which is a myriad test, whether that can predict or help to identify patients who may be more responsive to cisplatin or paclitaxel. So it's a TBCRC study. It's very well conducted. Unfortunately, they did not see any interactions between the score being high or low and the PCR rate from the cisplatin or paclitaxel. But there seems to be a trend that the HRD high group had a higher PCR rate with cisplatin, but either group seemed to have a similar PCR rate. So I think in the same line, there was another trial by the German group presented Gipper-Oller trial. So they, when they compared olaparib versus carboplatin when added to the standard chemotherapy like paclitaxel, and then followed by the EC chemotherapy, also in the neoadjuvant setting, comparing the PCR and in the population that had HRD high or had BRCA germline mutation, they didn't seem to pick out, or the PCR rate by adding olaparib or carboplatin didn't seem to exceed their expectations or meet their expectations. So they would have thought that it's going to improve the PCR rate to over 55%, but the trial did not. And so there are some interesting findings of how olaparib arm actually had a higher PCR rate in certain subgroups that needs to be further investigated. And then another study, for the HER2 positive breast cancer, most of the abstracts in early stage disease were focusing on in the neoadjuvant setting how we may be able to downstage or de-escalate chemotherapy. For example, using TDM1. There is an update of the Christine trial, which showed that with TDM1 compared to TCHP regimen, that the PCR rate was significantly lower. In this trial, TDM1 was also combined with pertuzumab. However, if they had a PCR, their invasive disease-free survival was still excellent. In addition, the event-free survival, although was inferior in the TDM1 and pertuzumab arm, but the difference was mainly due to early progression, not progression during the neoadjuvant setting, kind of before surgery. And they also looked at whether HER2 expression may affect the treatment efficacy of TDM1. So I thought that was interesting, since perhaps there are biomarkers that you could pick out that can select patients who may benefit with TDM1, which is much easier to tolerate than the traditional TCHP. And then the PREDEX trial compared TDM1 versus the THP regimen, and which shows similar efficacy in PCR, kind of PCR rate. So I thought that was really encouraging. And then I think there was a very interesting study presented by the Dana-Farber group that HER2 heterogeneity, meaning that if there's HER2 non-amplified tumor mixed in the HER2 amplified cells, then the response rate or the PCR rate would be much affected, and the study showed a really impressive difference if there is heterogeneity of HER2. So I think that's a biomarker perhaps would be further developed to select patients who may benefit from HER2 targeted agents, especially such as TDM1. So it's still kind of a work in progress. We hope to learn more in the future.